So we had in my family these two completely diametrically opposed ways of dealing with illness. We had completely wallow in it and medicate yourself to death and have everybody rolling their eyes at you, on one side. And on the other side was, no, nothing is ever wrong with me, and absolutely never go to the doctor under any circumstances and everything can be shaken off, basically.
Hey there. Welcome to In Sickness and in Health, a podcast about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Cara. I'm not a doctor or a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. Thank you so much for listening to the show. We've had such a great response to our dysautonomia series so far. At the time I'm recording this intro at 3:30 on Thursday afternoon, we've already had 435 plays since we launched on Tuesday. I'm blown away. This is the fifth and last episode in our series honoring Dysautonomia Awareness Month. If you haven't heard the other 4 episodes, go back and take a listen. We'll be back next Tuesday with a new episode, so keep an eye on your podcast feeds or on insicknesspod.com. On In Sickness and in Health, I plan to feature a wide variety of health experiences. But because dysautonomia is personal for me, I wanted to kick off the show with a series of interviews about something very close to my heart. I'm so glad I did. We've gotten such great feedback, and I've even tricked a few people into learning a thing or two. This podcast or any of its associated content is not medical advice. If you're experiencing a medical issue, please seek qualified medical help. I know the system sucks, but I wish you a lot of luck. If you want to know why I think these topics are so important, go back and listen to episode 0, Welcome to In Sickness and in Health. I explain why I started the podcast, what I've learned along the way, and what I hope the show will be. We're all going through this together, but I cannot stress enough just how different we all are, even if we were to have identical medical files. There are so many factors that go into shaping a person's experience of health and illness. Just because something worked for one person does not mean it will work for you or anyone else. I want to ask my audience to respect the very personal decisions of my guests, and remember that the choices of others do not reflect or affect your own choices. This is especially true about diets, which we talk about a little bit in this episode.
The approach to illness is really neatly split in half in a way that is frequently at war, in my thinking about being sick. So on one side of the family, I had a grandmother who was just a complete and total hypochondriac. She was constantly ill, constantly complaining about it. Any little thing was a giant thing. She took more medications, than anyone you could possibly imagine, with really no need for them. And when she, eventually went into nursing care at the end of her life, they were sort of horrified, and said her doctor really was irresponsible because she doesn't need most of these things. So I think she had, some dependencies. But I just remember illness being a real major focal point of her life and her complaining, even though there was very little actually wrong with her, and she lived a pretty long and active life. On the other side of the family, you have my other grandmother, who absolutely would not go to the doctor for any reason, just absolutely refused. No matter what was going on, she was fine and, strong and healthy, and there was never anything wrong. And when at the end of her life, she finally ended up in the hospital, they discovered she had had about 3 heart attacks that she had never mentioned or gotten treatment for. And, obviously they weren't fatal heart attacks, but, there was all this damage, and they said, this person has obviously had heart attacks, and she just didn't do anything about them. So it has created a really interesting war in my head around my own illness and around illness in general. When I do get sick or when something is wrong, I feel tremendous guilt. I also instinctively jump to the fear that I'm being a hypochondriac. So sometimes I don't go to the doctor when I should because I'm convinced they're going to tell me that nothing is wrong and I'll have wasted their time. This hardly ever actually happens. And I remember once saying to somebody, I wish just once a doctor would tell me that I'm actually being a hypochondriac. It would be nice, not to have it be some weird disease instead. But yeah, it's very complicated. There's almost a feeling of failure around being ill. and at the same time, almost a triumphant, see, I really was sick. I'm not being a hypochondriac, like my other grandmother. So it gets very complicated.
That's Cathy. She's a musician and mother who lives with the autoimmune diseases rheumatoid arthritis and Sjögren syndrome, dysautonomia that includes postural orthostatic tachycardia syndrome, or POTS, complex chronic headaches, and the still very poorly understood bladder condition interstitial cystitis. If you've never heard of or don't know a lot about these conditions, I put some links in the show notes to find out more. Cathy will explain more about what these mean for her in a bit, but if you want to know more about dysautonomia and its various forms, go back and listen to episode 1, Dysauto Whata? With Dysautonomia International's president, Lauren Stiles. She gives us a crash course on what dysautonomia is, and we talk about the diagnostic delay that many patients face, her own diagnostic odyssey, and some of the research that her organization has been able to fund. Before we get to the interview, I want to introduce a concept that we will be referencing a lot on the show. It's called the spoon theory, and it comes from an essay written by Christine Miserandino. As a young woman in the piece, she describes the process of explaining to her friend what living with the chronic fatigue of lupus is like for her. Chronic fatigue among chronic illness patients is common and very underappreciated by the medical community. There's also not a whole lot we can do about it. Flawed though they are, we have conventions like the 1 through 10 pain scale for talking about pain, but there's no language for talking about the kind of fatigue we experience. Use of the spoon theory to talk about fatigue and our limited energy resources has made its way into patient communities, and we'll be having plenty of conversations on the podcast where spoon management comes up. I'll link to the original essay in the show notes, but since Cathy mentions the spoon theory in our conversation, I'll let her explain just what that means.
So the spoon theory is a theory of chronic illness that helps explain chronic illness to people who don't have it. And the premise is that you start every day with a certain amount of spoons, a limited amount of spoons, and everything you do,
and the
big or
spoons
small,
represent how much energy you have for the day. Exactly.
That's right. You only get that many spoons, and every little thing you do, like no matter how small it seems, takes a spoon. So you get out of bed, that takes a spoon. You shower, that takes a spoon. You prepare breakfast, etc. And when your spoons are gone, they are gone. There's no replenishing them, and there's no way to get them back.
And sometimes you can borrow them from future days, but there's pretty big consequences for doing
that. Yeah. Sometimes if you spend all your spoons and then some, you spend 3 days in bed because you did that.
And one last thing. I want to take a moment to encourage you to get a flu shot this year, if you can. In the United States alone, the flu kills 36,000 people a year, and more than 200,000 people wind up in the hospital because of it. We hear a lot about the very, very young and the very, very old who are at risk for these kinds of complications, but there are millions of other people at risk because of primary or acquired immune deficiencies. It's likely that someone you know and love is at risk. People like Alana, who in episode 2 talked about the challenges of living with a primary immune deficiency disease. And people like today's guest, Cathy, and others with autoimmune diseases who take medications that impair the immune system. Then there's people like me. I don't have any immune deficiencies, but getting sick with anything puts me at risk of serious complications due to my underlying chronic health conditions. Others cannot get the vaccine due to problems with their immune system or an allergy to the ingredients. Those people rely on herd immunity and the people who are able to get vaccinated. The flu is not fun for anyone, but for some people the flu can be really dangerous. Contrary to popular belief, the flu vaccine does not cause you to contract a mini version of the flu. Some people experience flu-like symptoms after the vaccine due to immune system activity. I'm one of those people, but I get the flu shot anyway because I know those symptoms will pass within a couple days, and it's a whole heck of a lot better than getting the actual flu. Many of the major pharmacies even offer flu shots right in the store, so please get a flu shot if you can. Don't forget to wash your hands this flu season, and make sure you cover your mouth when you cough and sneeze, preferably with your elbow and not your hand. I'm really excited to share this interview with you. This is one of my favorite interviews that I've done so far. Cathy had so many interesting things to say, some of which made me rethink some things about my own condition and how I handle it. I hope you enjoy this interview as much as I did, and stay with us until the end because Cathy actually shares with us 2 of the songs that she wrote while processing the grief of her illness.
So my first and main diagnosis is rheumatoid arthritis, and my particular flavor of that is severe seropositive rheumatoid arthritis. Seropositive means that it shows up in the blood work, that I have multiple, markers, antibodies, things like that, are completely conclusive, which in a way makes me one of the very lucky ones. There are people who, can't get a diagnosis for years because their blood work isn't showing the classic markers. So I'm lucky in that respect. What's unlucky is that people with severe seropositive RA tend to have poorer outcomes, shorter lifespans, more complications. It's harder to get under control. So it's sort of a mixed bag. I'm grateful that I have definite answers, because that's one of the most frustrating things about being sick is not knowing what's going on. But there's a flip side to that. So that's my RA. Then in addition to that, I have secondary Sjögren syndrome, which is an autoimmune disease, also just as RA is. And it affects the moisture-producing glands of the body. So things like your tear ducts, your salivary glands, and pretty much anything else you can think of in terms of your organs and systems that produces any sort of moisture or mucus or things like that are affected. This is another area where I've been lucky because it's incredibly mild. Like I would never have even known it existed if I hadn't tested positive for the antibody to it.
Which is another thing that a lot of people who actually have Sjögren's have a hard time, having those antibodies don't show up and they have to wind up getting crazy things biopsied.
Exactly, and I had the opposite experience. I had these antibodies show up with very few symptoms. And the symptoms that I did have, were fairly well controlled, by the same medicines that I was taking for the RA. The only real change that I've seen is that I don't wear my contact lenses anymore. I wear my glasses. So that was a rough change, because I just don't make enough tears now. And I have to see the dentist and the eye doctor a lot more often than I used to, every few months, just so they can make sure I'm not getting dental damage or my eyes. My eyes are aging a little faster than is normal, because of the tear ducts. But the Sjögren's has not been that big a deal. So those are kind of the 2 big autoimmune things. And then these autoimmune things like to invite friends.
They sure do.
So I would say once a year or so I get diagnosed with some new random thing. And usually it seems totally unrelated. And then I'll talk to my rheumatologist and he'll say, sure, I see that all the time. And it's very weird. So I have a bladder condition called Interstitial Cystitis, which is an inflammation of the bladder lining, and some pelvic floor dysfunction that goes with that, just the whole area kind of being unhappy, which you can imagine treating that is not fun.
Yeah.
So that's not one of my favorite conditions, and I was surprised to learn that there was a link to RA with that because it really doesn't seem to have anything to do with it. Then this past year, I was diagnosed with POTS, which is postural orthostatic tachycardia syndrome. I think I got that right.
You did.
And what this means for me, again, my case is pretty mild of that, but I tend to have very low blood pressure. My normal range is around 90/60. And if I stand up too quickly, it will plummet. It'll drop, 20 points or so, and I get very dizzy, and I've been lucky that I haven't had, flat out fainting episodes. I just have ones where I kind of, everything goes dark and I have to sit down on the floor immediately, and
emergency lay down. That's
exactly,
what I like to call them.
So I get emergency lay down. When I get my infusions, which we'll talk about later, the medication that I get for my RA, they have to do the infusion extra slowly. They give me an extra hour's worth of time, and they put an extra, like a double-sized bag of saline, because the infusions have been known to make the blood pressure drop, like to 70/50 or things like that. And, there have been a couple of scary episodes with that. So they're careful with me, and they always monitor my blood pressure a lot because of that. So it's been a complication. It also makes you very tired, so there's been that. And I'm sure I'm leaving one out. Random little things like,
you mentioned you get migraines as well?
Yes.
Yeah.
I do. I have some cervical spine damage from the RA, so it was triggering cervicogenic headaches, but then those started triggering actual migraines, and so I have this unfortunate combination of, real migraines with these neck tension headaches.
Yeah.
And
I get those
sometimes,
too.
yeah, so sometimes I'll get just one and not the other. Sometimes they come together. It really depends.
Yeah.
But those are not fun, and those also didn't appear until about a year or two after the RA diagnosis. So that was not something I always had. Aside from that, I had a breast lump removed, but I really don't know what that has to do with anything, except for the fact that it turned out, and it just made me laugh, it turned out to be this unbelievably rare benign tumor, and I'm just like, I'm so sick of hearing the words unbelievably rare
I know. Yeah.
when it comes to my health that,
Yeah.
it was just kind of funny. Then there's things that are related to the drugs. Like, for example, I was on a lot of prednisone in the beginning, trying to get the RA under control. So I developed adrenal insufficiency, and my adrenal glands kind of shut down, stopped working.
That's always fun.
That was fun. So I had to wear a medical alert bracelet, and carry emergency steroids in my purse and a needle, and had a lot of trouble, getting out of bed and recovering. But, fortunately, I did make a full recovery from that.
That's great.
But it was a warning sign, and kind of told my doctor that we need to be very careful about me and steroids, because, I'm one of the lucky sensitive ones, Again, if there's like something they say, well, this happens once in a while, or this, every now and then, I'm going to be the one usually who gets that complication.
Right. It's funny. I'm just like, as you're talking, I'm like, I have that.
Yep.
I have that. I have that. Yep. Also that.
Yep. I'm sure I'm forgetting one too.
Oh, probably. I always do.
Mm-hmm.
Even when I'm at the doctor, they're like, anything else? I'm like, no. And then I get home and I'm like,
Yeah, I'm like,
oh,
forgot to mention this.
this
right.
really big thing that's been bothering me for weeks that I completely forgot about. Yeah.
Right.
So, you talked a little bit about having some denial about what you have going on.
Absolutely, yeah.
So I'm curious about kind of how does that manifest, and have you experienced denial from anyone else, family members, doctors, friends, that side of thing?
Luckily, I didn't really experience it from the doctors, and I know that this is fortunate because I've talked to so many people, who had the hardest time getting a diagnosis, and that's really painful to go through, and especially with the family history I've mentioned with the hypochondria and all this stuff. That would have been a nightmare for me to go through years of thinking I was being a hypochondriac and not knowing. I was diagnosed within 8 months, of the symptoms starting, which is pretty short, compared to most people. I don't really know how long before that I actually had the disease, but 8 months from the onset of acute symptoms, I had a concrete diagnosis in hand. And so the doctors were never in denial, and that was upsetting to me. I kind of wanted them to be. Like, I wanted to be told this is not that big a deal, and nobody was saying that, and it got a little scary. My family probably had a little bit of denial, but it was more along the lines of you're going to be fine type denial, like, where they come out with the hero stories of people with disabilities who've done great things with their lives. And
So helpful.
So helpful. I just love those stories, which we can talk about more later.
Yeah.
My own denial was incredibly complicated because it didn't look like denial. The first 2 years of being ill, I was in total emotional denial and did not appear to be, because I was doing research. I learned all the facts I could about this and pretty much every other disease. That's how I know about Ehlers-Danlos syndrome. Mm-hmm. So I knew all of my facts. I knew the prognosis. I knew all of the treatments. I understood what every code on my blood work chart meant. I went online and joined the Arthritis Foundation support group and discussed things with them. So it didn't look like denial. It looked like I was facing it head on. Mm-hmm. But it was further complicated by the fact that I was pregnant when I was diagnosed.
Oh, wow.
And that meant that I could not be treated for the disease for the first year. So I didn't have to deal with the reality of any of the drugs, with the exception of the steroids, which, in the very beginning were necessary to get me under control. About 70-80% of women go into remission during pregnancy with RA, and I was one of the lucky ones. So by the second trimester, I was feeling really good. Mm-hmm. So here I am saying, yes, I have RA, talking about it, researching it, and not believing it, mm-hmm. On this very basic level. Because I felt fine and wasn't taking any medicine. And this went on, for almost a year. The baby was born, and within 4 months, I was completely incapacitated. I couldn't get off the couch. I couldn't move. I couldn't breathe. Like, my lungs had gotten involved, and, I was having asthma attacks multiple times a day. out of nowhere, getting shots in the soles of my feet and being laid up on the couch for 2 weeks. And, it hit hard, and worse than it was before the baby, so it came back hard and viciously. And so then that next year was spent navigating the denial part of it. I started steroids and I gained 40 pounds within 2 months, and got the big puffy moon face all of a sudden.
Yeah.
Didn't recognize myself. And what really did it was I was also in graduate school at the time, and I was doing a graduate program. I was in residency during the summer and then doing it online during the rest of the year. So, almost a year would go by before I'd see the people in my graduate program again. And when I came back, after having gained all that steroid weight and walking with a cane, and everything else, the look of shock on people's faces started to shake me out of the denial a little bit. I was also weirdly silent about the whole thing. Like, my family knew what was going on and one or two of my closest friends, but I absolutely would not tell anyone else. Like, I just never, ever talked about it. And what really shattered it was having to go to the Office of Disabled Services at my school, because there was going to be a 4-hour exam where I was going to have to write longhand. And I knew that this was not going to be possible for me. And also that I needed a parking permit, because I was not able to walk to class. So I kind of, spoke to my doctor and was really expecting him to say no, because I had heard he was really tough with parking passes. Like, he wouldn't give one to his mom when she asked, and she was like 90 with arthritis. And the fact that he said sure so easily surprised and upset me. And I think the defining moment was when I walked into the Office of Access and Services for Disabled Students, and the man behind the desk was blind. So I walked in and said, oh my God, what am I doing here? I don't belong here. I'm completely fine. Here's this blind guy. How am I going to explain to him why I need services? And I'm walking around and, there's nothing wrong with me. And so I sat down and started talking, and he said, well, let's talk about what you need. Let's talk about what your condition is, and let's talk about how things are. And I said, well, I don't really know what I need. I have good days, I have bad days. On good days, everything is normal. On bad days, I can't do anything, and I don't really know when the bad days are going to come. And for the exam, mostly the prospect of writing longhand for 4 hours, I just don't think I can handle that. So he set up accommodations for me to be able to take it on a computer and use voice-activated software, which really saved my life. And then he said the thing that really shattered the denial. He said, I feel sorriest for the students like you. And I'm staring at him and I'm thinking, the blind man feels sorry for me, like, so the cognitive dissonance of that moment really struck me. And I said, why is that? And he said, because your disease is both progressive and unstable. You know that you're going to get worse. You know that the future is not a good one. And it's unstable because from day to day you can't rely on how you're going to feel. And then he talked about his process of going blind, which happened gradually over a period of years. And he said the problem is you get used to a certain set of accommodations, and then they don't work anymore. And then you get used to another set of accommodations, and then they don't work. And he said, when I finally reached the bottom and was completely blind, there was relief. Because now I knew, what it was going to be, and it was okay. But getting progressively sicker is terrible, and when you're in the phase where every day is different from the last, that's an awful place to be. So I went home and cried for hours. And I think, the combination of his sympathy, the fact that nobody laughed me out of the office and said, there's nothing wrong with you, the fact that my doctor issued me a parking pass, with the wheelchair on it, with no problem doing so, my denial totally cracked that day. I was like, I can't not look at this anymore. So that was when, that was, I think, the first time I really faced it. Yeah. And after that, my handling of it was different.
Yeah. In what ways did that change?
I started looking for ways to process it. I spoke to more people about it. I kind of talked about it too much probably for a while, went from total silence to, telling more people. I wrote songs about it. I wrote 3 different songs about the illness, and processed it in that way, and just kind of went through a deep grieving process that I think had to happen and that had been delayed for 2 years. An earlier defining moment that I managed to get over without quite the same amount of revelation was when I had to stop breastfeeding my son at 4 months. When my rheumatologist sat me down and said, "This can't go on. You can't walk, you can't breathe, you can't move, knock it off. We've got to get you on the meds." And the meds he was putting me on were incompatible not only with breastfeeding, but with future pregnancy. Like, they made that not a possibility because they were toxic. So there was some crying around that too, but somehow it didn't have the same effect as the blind guy feeling sorry for me did.
Yeah.
Sounds kind of terrible to say it that way.
No, I think that makes perfect sense. Like, just because culturally our idea of like what a disabled person is so narrow.
Yeah,
that
I didn't see myself that way at all.
Exactly. It's easier to kind of understand the challenges that might be involved in that, whereas somebody with an invisible illness who,
Right.
From the outside, they might look normal, even if you've gained 40 pounds of prednisone weight or whatever, even if you're using a cane, it's still hard to really put yourself in that and understand how that might affect a person's life. So
a very big surprise for me came a couple of years later when I was, because I was not telling anybody in my graduate program. I didn't tell anybody except the Office, of Disabled Services. I didn't tell any of my fellow students or professors. And they were all just kind of staring at me, and I figured they thought I had just really let myself go after the baby, and I made up an excuse about my ankle, bothering me. And I thought they believed me, and a few years later, when I finally did come clean about what was happening to one of my fellow students, she said, "I knew you were really ill." And she said, "I wondered what was wrong, but you clearly didn't want to talk about it." And so that was hard too, realizing that I hadn't been as invisible as I thought.
Right.
Because I'm pretty invisible now, I think. I don't think anyone can tell anymore.
Yeah. So tell me about your relationship with medication. Do you have any mixed feelings about it?
Definitely. I wrote a letter to myself on prednisone once. Prednisone is one that I have really mixed feelings about.
Oh, I think everyone does.
Everyone does. Because, when you need it, it's an absolute lifesaver. It transforms everything. If you're in really bad shape, all of a sudden you're not. And that's a miracle. And it comes with a host of the most horrible side effects you can possibly imagine. And I got every one of them.
Mm-hmm.
The adrenal failure, the giant moon face, the massive weight gain, the, temper outbursts. So I wrote a letter to myself once, and I wrote, "Dear me on prednisone, you're about to start another taper of prednisone. Please remember, the girl at Starbucks did nothing to you that should make you yell at her. Your child is a sweet, loving child who doesn't deserve, anger." You get the idea. And it was, you're going to want to do everything in the world, but have no mental focus. So here's a list of things you can do, and it was very funny, but
well, that's great.
I mean, to be able necessary.
to be able to kind of plan and have a contingency plan.
Right. And
when
they fell apart,
Oh, they always do.
Totally fell apart.
But, yeah.
I wrote, "Don't eat an entire pan of brownies," and then I ate the whole pan of brownies anyway.
Well, why wouldn't you?
Exactly. So prednisone, I've been off it for years because it's now not a good idea, with my adrenal problems, and I'm grateful for that. Methotrexate, I have a very hard relationship with it because it's a cancer drug. That's what it was designed for. And some part of me can't quite forget that. Like, even though I take it in lower doses than cancer patients, it's still, the word cancer just flashing over my head whenever I think of it. Plus, it makes me very sick.
Yeah.
So I lose a day a week, and I take it on Saturdays so I don't go out on Saturdays, and then Sundays I feel hungover. And it's the one that means I can't have another child, as long as I'm on it. So that one was difficult. My big gun is Remicade, which is an infusion drug. And right now I'm on the maximum possible dose at the shortest possible interval. It took 3 years to get my disease under control. And it took going to the absolute top, limit of that drug to make it happen. So I go in once a month for an infusion. And again, that appears on all of my bills as chemotherapy, which really upsets me. You know? Plus you read the warning labels and the little boxes, and then there are the drugs you have to take to manage the other drugs. Like I have to take Prilosec to keep my stomach from going crazy from the methotrexate and the anti-inflammatories. And then there's the drug for the bladder condition. And sometimes I wish I could just chuck it all. But I also know from experience, because I did go unmedicated for that whole year I was pregnant. And I had a lot of time to kind of chase down alternative cures and found they were not going to work for me, unfortunately. For every story of a person who heals themselves, by giving up gluten or by doing whatever, there's 100 other people who don't.
Right.
And the person I'm most grateful to is a naturopath who I went to see looking for a miracle, who sat me down and said, you know what? Anything we could do for you would take months to have any effect, and in the meantime, this disease is going to destroy your body, so just don't, just get on the drugs, just do it. And, she said, we can do things to support your health. I take probiotics, I take fish oil, but she said, I'm sorry, there's not going to be a cure for you, with your severity in this arena.
I mean, so many of us get suggestions from people that, the person
they're
who's
well-meaning.
They're well-meaning. They're trying to be helpful.
And there's a subset of people for whom these things help.
Right.
It's just a much smaller subset than most people seem to know.
Right. And the people making the suggestions don't really take into account that most of us have tried that stuff already.
Exactly. If there's a cure, I've heard of it or thought of it or tried it. Mm-hmm. And there was one woman, I remember I used to follow her blog. She was absolutely convinced that she had cured her RA, by going paleo and cutting all these things out of her diet. And she had been really meticulous about it and had eliminated all these, food allergens and stuff. And she felt fantastic and was really happy. And then one day she was feeling a little twingy, went to her rheumatologist, and it turned out the disease had been continuing all along, just under the surface, destroying her body. Mm-hmm. And that was heartbreaking for her, and for other people that had looked to that as hopeful.
Right.
But yeah, I've had people tell me to take gin-soaked raisins, to eat sour cherries, to cut gluten. Gluten is a big one. People love to tell you to give up gluten.
Almost everyone I've talked to has, and some of those people actually don't eat gluten because they found that does actually help a bit. If it helps them,
great. And,
but it definitely didn't,
it didn't help
cure
me at
them.
all. It did nothing for me. And I had tests. I don't have celiac and I'm not allergic to any of these things. Mm-hmm. So yeah, I get a lot of suggestions for cures and people really, really fervently believe in them. And that makes it tough too. Because there's also a certain element of victim blaming there.
Oh, they're big time.
That,
you're just not trying hard enough.
Exactly. And it must be something you're eating. It must be something you're doing wrong. In spite of the fact that, the person next to you can stuff their face with Twinkies, all day long. It kind of puts an onus on you to really have this extremely restrictive diet or lifestyle that in the end, makes no difference for my disease progression.
Yeah.
So yeah, I've learned how to kind of nod and say, yes, I've heard of that one. Thank you.
I still have a hard time not wanting to punch the person in the face. But
that is difficult.
I don't do it.
Yeah.
And I do not condone punching people in the face, but
sometimes
I want to.
Gluten is the one where people get incredibly sensitive.
Yeah.
Because anybody who has real celiac disease, has a reason to be up in arms about that. Mm-hmm. But there are a lot of other people who just think that gluten is bad for everybody and for all conditions, and it's just not. So that's the one where I have the hardest time. A lot of people really feel that the fact that I'm still eating wheat is why I'm sick.
Right.
I want to make clear here that we're not saying that cutting out gluten doesn't work for anyone. It works for some people to some extent, and it's extremely important, as Cathy pointed out, for those with celiac disease. But that's not what we're talking about here. Each person is different, and different dietary changes work for different people. For example, when my stomach acts up, bread products are just about the only thing I can eat. But I know I have a problem digesting other things like corn and brown rice. Those are two of the main wheat substitutes used in gluten-free food, so a gluten-free diet doesn't make much sense for me. I've tried it, and it really didn't work for me. Again, that is for me. If it works for you, that is awesome. Please, get down with your gluten-free bad self. But what we're talking about here is how incredibly frustrating it can be to get the same uninformed suggestions for lifestyle changes over and over and over again, especially when you've already tried those changes and it didn't make a difference for you.
People get a lot of crap from every angle about their diets, so I'm really going to try not to do that here. Like I said about health in general, there are so many factors that go into shaping our diets, many of which are completely out of our control. Diet is, of course, important to health, and we'll talk about it, but I'm much more interested in just about everything else. Food allergies are disabilities too, and it's not something to take lightly. Many people also find they have non-allergic reactions to things. So if somebody says they can't eat something, try not to be a jerk. But also, don't be a jerk about telling other people what they should or should not be eating. Unsolicited suggestions for lifestyle changes are almost never not annoying.
So you're a musician.
Mm-hmm.
How has your medical condition affected that?
It was really one of the worst things that can happen to a musician. It's also very stigmatizing. Chronic illness, in the music world, that it's a terrifying thing because your livelihood depends on something incredibly physical. So I had a lot invested in hiding my disease, and that was one of the reasons for my, 2-3 year stretch of denial. I still don't tell anyone I work with that I'm sick. No one knows at work. None of my students or families or, anybody else that I work with or play with has any idea, and I intend to keep it that way. In the beginning, I made the mistake of telling one work colleague, in one particular place what was happening, and all work immediately shut down from that quarter. Like I stopped getting calls, from anybody associated with that group. And that taught me a lesson, really fast. So unfortunately, in the music world, there's a real need to hide anything that could be perceived as disability or illness. It did change a lot of things for me, and that was also part of the grieving process. I had some career dreams that I was working towards at the time that are absolutely not going to happen now, and they're just not, because they just require too much physical stamina. They were very performance-based and involved performing for like 9 hours a day, that kind of thing. Just not capable of it anymore. Before I got sick, I was working, a freelance life 7 days a week, and very random. I taught Saturday mornings starting from 7:30, and then I'd teach a class, Wednesdays until 10 o'clock at night, and then I'd go perform, 2 shows a day for 4 days a week. And like looking back, I don't know how I did that.
Yeah, I mean, that's physically very taxing for anyone.
It was ridiculous, and there's just absolutely no way I could do that now. So the balance has turned much more towards teaching than performing. I still perform, but I have a lot of fears around it. There's always the possibility, well, what if that's the day I get a really awful flare? And I'm a little bit comforted by knowing that, prednisone and shots exist, so that if I absolutely had to, I could make it through. But I also know my days are a little bit numbered. There's only so long that I'm going to be able to do that. Mm-hmm. So there was grief in letting go of the big career dream, the career I really wanted. And there's a lot of joy in the career I have now, so once I got past the grief, it was good, but I had to grieve first.
Oh, yeah. I think no one tells you that you need to go through a grieving process.
And I wouldn't do it for a couple of years,
yeah.
Like I said, but
I didn't even realize it until I was having, one minute I'd be angry, and 1 minute I'd be so sad, and I'd be like, you know what, I'm just going to act like this isn't a thing. And,
yep.
and then I stopped and was like, oh, I'm grieving.
That's what this is.
Those are
the stages they talk about.
Exactly. And it's never like a linear
nope.
thing. It just kind of swings from one to the other, back to another.
And there's bargaining. There's, I'm just going to take these prednisone pills just this one day so I can get through this one performance, and please let that be all right. And, and you make trade-offs, and it's hard.
Yeah.
I think writing the songs was a big part of my grieving, because I'd never written a song before like that.
Really?
Like, songwriting is not part of what I do. And it was a way of finding an alternative, like another musical outlet, because the one I wanted was blocked off. Mm-hmm. And that helped a lot, taking something I loved and finding a different way to do it.
If you stay tuned for the end of the episode, Cathy was generous enough to share those songs with us.
I think that's really important to, to not give it up entirely, and to say, like, okay, this is my life now. This is what I have to deal with. How can I continue to do this thing that I love within those parameters?
And there were certain things I never did find a solution for.
Yeah.
Some things just fell away forever.
Right. Can you give me a snapshot of when somebody did something or said something that was very clueless or inconsiderate about your medical condition?
Oh, boy. That's such a hard one, because there are so many. I mean, there's all the cures that we talked about, people offering cures, there was the person who told me that they had read a book by this doctor who claimed that rheumatoid arthritis was psychosomatic.
Oh, sure.
And I said, yeah, okay, take a look at my lab work and my x-rays and, explain how my brain is destroying my joints. I'm interested in hearing about that. So I read the book and found out that he also thinks cancer is psychosomatic. So then I felt a little better. But, when I pointed this out, she was just like, well, you're just in denial. So I'm like, okay. One that really made me angry, and it's a funny one. So I had explained this spoon theory to somebody as a way of helping them understand what I was going through. And at the time, they appeared to take it in. And then sometime later, several months later, we were having an argument about something. And she said to me, you know what? This is a 5-spoon conversation, and I don't have time for this. And I was like, how freaking dare you appropriate this? Mm-hmm. This analogy that I gave you to understand a chronic illness that you don't have, and how dare you turn it into a metaphor for normal tiredness, normal anxiety. And
yeah.
It's hard to explain why that made me so angry. But it was, all she took from it was, well, I'm tired today, so I don't have spoons.
Yeah.
And
I actually found the spoon theory because I one day realized that when I say I'm tired, people have no idea what I'm talking about.
Exactly.
And so I Googled how to explain how tired I am.
Right.
And that was how I came across it, because it's just, there's no comparison, and there's really, no language to even mm-hmm. explain to someone. Some people might experience that level of fatigue if they have the flu, but they get to get up and walk away
better
at the end of it. Yeah,
exactly. And so that made me very angry. I thought that was incredibly insensitive to, take and borrow as her own this language that did not describe at all, what she was talking about.
Yeah.
Yeah, the concept of tired.
It's a big one.
Yeah, it's changed a lot.
What do you beat yourself up for?
Oh, gosh. Being sick in the first place. There's, that dynamic with the grandparents, the hypochondriac versus the, you walk around on the broken leg, I beat myself up for being sick at all. I beat myself up an awful lot for inconveniencing people. I have to be driven to my infusions because they give me Benadryl, which knocks me out, and I'm also usually not feeling so great after. I feel guilty every single time, somebody has to take care of me. I feel horribly guilty that my son has food allergies because the allergist said to me, it's probably inherited from your autoimmune condition.
Thanks for that.
I was like, thank you so much. I felt really good about that. I beat myself up for a lot of things, for potentially having set my son up, for future autoimmune conditions, for not being able to provide him with a sibling. It goes on and on. Mm-hmm. For the things I can't do, for the things I probably could do but don't, it's, I think a lot of beating up goes on.
Yeah.
And yeah, I don't know, I could probably go on, but that, that about sums it up. There's just tremendous irrational guilt around the whole subject of illness.
Right. Yeah, and like
and
objectively, if you take a step back, it's like, I'm not actually responsible for this, but how do I not feel responsible?
If I looked at somebody else, I'd see it differently, but I feel it's my fault somehow. Something I did, something that made this happen.
Yeah. I actually blogged about that last week because I think it's something that we all kind of go through. Yeah. So what is it that you worry about, like, future-wise? Is there something big or little that takes up a lot of space in your brain?
I worry about my son a lot. He's young. I worry about his health future, although he's a pretty healthy guy, except for the allergies, so crossing fingers that stays true. I worry about my ability to take care of him. I worry he's missing out, because I spend so much time, lying on the couch or not able to run around, like the other moms. I worry a lot, and this one is very hard to face, and this one I'm only able to touch every now and then in a surface kind of way. In the last few years, 4 people I've known, 2 who I knew personally and 2 more who I knew online, have died from RA. And, people don't understand that. They hear RA and they say it's arthritis. Nobody dies from arthritis.
Yeah, you just have achy joints.
Right, but rheumatoid arthritis, goes after everything, not just joints. And, one woman developed lung nodules, couldn't breathe. Another had the lining of her heart attacked, and had a heart attack and died. And some of the people who've died have been younger than me. That's a very real fear, and if I look at the statistics, I know that I'll die probably younger than I otherwise would. I push that one back a lot.
I can see why.
But, when a friend with, who shares illnesses with me dies, it really scares me.
Yeah, and it's a loss of your support system, too.
There's also that.
Yeah.
There was one woman I feel especially, and this also, there's guilt, and it's irrational guilt. There was a woman who I knew in person who developed RA and came to me, for help, basically. Friends introduced us. They said, Cathy has RA, you can talk to her. She'll, talk you through it. And I told her, it's going to be okay. And it was not. She died,
Yeah.
And I know, what else could I have said? And I talked with her very honestly about what it was like. I gave her an ear. Anytime she was in pain, she could call me and we could talk about it, and she didn't have to hide anything. And I did what I could to support her, but in the end, I told her it would be okay, and it wasn't. And I still feel some funny guilt about that.
Yeah.
So yeah, there's that dark fear.
Yeah.
And that one's hard to explain to people who don't see how you can die from arthritis.
Right. Well, people don't really understand that, there's, for a lot of people with RA, there's organ involvement.
Exactly.
And that can escalate, And,
yeah.
Yeah. What are your goals and priorities with the management of your condition?
Right now I'm in drug-induced remission. Yay!
Congratulations.
Thank you. It took a long time. And another of my, going back to the previous question, one of my fears is that that's going to end at some point, because it will. Statistically, it's going to end at some point. And I'm already 2 years over the mark, from when the meds usually stop working and you have to switch to something else. So my goals are to hang on as long as I can, just keep this remission going as long as possible, and use the energy that I have, in ways that are productive, but that are not going to make me worse or make the remission end prematurely.
Yeah.
And kind of setting up a sensible sort of life. Like I do things like have my groceries delivered, have my house cleaned, things that would have seemed like luxuries before. Mm-hmm. I look very carefully at how I spend my energy.
Yeah.
Now. So those are my goals, for managing, is just to save my energy for the things that matter. Mm-hmm. Take advantage of the times that I'm feeling well in ways that don't hurt me, because I used to overdo.
Mm-hmm. Yeah, it's so hard to, when you have a good day, not want to do all of these things that you've been unable to do, and then
and I've done that
for
before.
it for weeks afterwards. Yeah, I do that far more often than I'd like to admit.
Exactly. Yeah. So I guess those are the goals in the management. I'd love this remission to last as long as it can.
Yeah, I hope it does.
Yeah, I hope so too.
Thank you so much for talking to me.
You're welcome.
Thank you so much for listening to In Sickness and in Health. I hope you enjoyed this episode. If you did, subscribe and stay tuned for everything we have to come. And check out our episodes celebrating Dysautonomia Awareness Month that are up right now. We'll be back with a new episode next Tuesday, and you can find us in your podcast feeds and on insicknesspod.com. You can also find us on Twitter, Tumblr, and Instagram at InSicknessPod. Please rate and review us on iTunes. It helps other people find the show. And tell your family, tell your friends, tell your doctors. But most importantly, don't forget to be excellent to yourselves and each other. This is one of those songs Cathy talked about writing to process the grief of her illness. It's called Easy.
I watch you move, your steps are even, you make it seem so easy. Your back is straight, your hands are open, and everything is easy. But in the morning I will wake with fingers curled and feet that wait to feel the broken glass. And you are out there somewhere moving through your day while I wonder, will I move today? Don't try to tell me that it's easy. You don't know what it's like to crawl. And someday I will hit the ground running, but today I won't hit the ground at all. No, not today. Today I won't hit the ground at all. You start, I stop. You run, I stumble. The way you move is easy. You hold, I drop. You catch, I fumble. And nothing's ever easy. But then one morning I may wake to find my world has changed and everything is better now. So I will hold out for that day when I don't have to stop and wonder, will I move today? Don't try to tell me that it's easy. You don't know what it's like to crawl. And someday I will hit the ground running, but today I won't hit the ground at all. No, not today. Today I won't hit the ground at all.
And this is the other song called Don't Let Me.
I used to dance instead of walking. I never had to slow down. I could do anything. I used to sing instead of talking. There were so many songs to sing. I used to dream instead of thinking. I never planned ahead. I thought I'd live forever. I used to swim, but now I'm sinking. And all my dreams are washed away. I know that I should find new dreams. I cannot stay here in the wreckage of the old, but I just can't let go. Don't let me ever forget me. I know I've changed, I'm not the same, but I'm still me inside. Don't let friends dance on, their steps are light and free. I cannot follow now, I'm falling far behind them, and some move on, but some come back for me. Guess that's just how it has to be. And while they dance and sing their songs, I sit and dream about the life I used to know. It seems so long ago. Don't let me ever forget me. I know I've changed, I'm not the same, but I'm still me inside. Don't let me ever forget me. There must be some way